today's webinar, Partnerships to Prevent Fire and Burn-Related Injuries Among Children. Today's webinar is sponsored by the Children's Safety Network. I am Zena Gontro. I am a Senior Policy Advisor with the American Nurses Association, and it is my pleasure to be today's moderator. The American Nurses Association is a proud member of the Children's Safety Now Alliance and enjoys working with everyone. So today's funding sponsor is supported by the Health Resources and Services Administration, or HRSA, which is under the U.S. Department of Health and Human Services, under the Child and Adolescent Injury and Violence Prevention Resource Center's Cooperative Agreement for $5 million with 0% finance with non-governmental sources. The information or content and conclusions are those of the author and should not be construed as the official position of or policy of, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government. I'm going to now turn it over to Kate, who will walk you guys through some technical tips.
All right, thank you, Gina. This is Kate Sinclair with Children's Safety Network. If you can hear me right now, you'll notice that audio is being broadcast through your speakers. The quality of your audio is dependent upon your internet connection. If you experience issues with the audio, you can dial 866-835-7973 and make sure to mute your computer speakers. You are muted and will be muted for the rest of the webinar. We ask that you use the Q&A box to your left. If you have any questions, we'll answer all of our questions in our facilitated question and answer session near the end of the webinar. The file share pod at the top left of your screen has the download of today's slides. And this session is being recorded and will be posted on CSN's website within the next 2 weeks. Thanks, Nina. Back to you.
Thank you so much. It is now my pleasure to introduce today's presenters. First, Elise Omaki is a research associate and a core faculty member of the Johns Hopkins Center for Injury Research and Policy. She has over 10 years of experience conducting injury prevention research and practice on a range of topics and has a particular interest in the epidemiology of fire-related injuries and actively works with fire departments around the country to execute best practice smoke alarm distribution programs, working with teams in the public and nonprofit sectors to adapt and implement injury prevention efforts. She's committed to translating research into practice. We are also joined by Monica Owens-Doyle, who is the National Program Manager for the American Red Cross Home Fire Campaign. She was recognized in 2012 as a White House Champion of Change by the Obama administration for her work in building community resilience. She joined the National Headquarters team in 2013 and helped to develop and launch the Home Fire Campaign in 2014. Through the program, she manages over 2.1 million smoke alarms that have been installed throughout the United States via in-home visits to over 900,000 homes. We are also joined by Sam Johnson, who's the program lead for youth preparedness for national headquarters at the American Red Cross. She began her career with AmeriCorps for the American Red Cross of Alaska and then supported long-term recovery work in the U.S. Virgin Islands after Hurricanes Irma and Maria. Ms. Johnson currently manages 2 youth preparedness programs that have reached over 1.5 million youth since 2015. And with that, it is my pleasure to turn it over to Elise.
Great. Thank you, Zena. So I am going to be talking today about home fire and burn prevention and what we've learned through some of our research at the Johns Hopkins Center for Injury Research and Policy. So there's about 350,000 pediatric burn injuries every year. These are data that come from 2016. And you can see from this display that about half of burn injuries are thermal burns. These are typically from a heat source, and it could be from a home fire or from other heat sources like a heater or from cooking. Another about 25% of burn injuries are scald burns, and this can be either from hot tap water, if like a bath or shower is too hot, as well as we hear about some really tragic burns where a child might pull down a pot of boiling water onto themselves and be burned in that way. And we see some smaller portions of burns come from chemical burns and other sources, totaling about 350,000 burns per year. When we look at this by age categories, again, we can see here the most burns are caused by thermal burns, particularly in children under 5. This is an age group that's still learning to coordinate, still learning to understand boundaries, and may not know how to evacuate from a home independently if there is a fire. So we see most of the burn injuries in children under 5. Congratulations to those who answered our poll question correctly. When we consider pediatric deaths from fires and burns, most deaths occur because of a home fire. And so what you see in that blue shaded area are the number of home fire deaths each year since 2010. A smaller proportion come from other fires, and this might be, like a building fire, a hotel fire. And then finally, a handful of deaths due to hot objects. This would be kind of the hot water and scald burns or chemical burns that we saw in the earlier sections. The lines in blue down below represent the number of deaths from home fires by age. And so again, similar to the previous slide, we can see here that children under 5 have the highest burden of deaths from home fires, with children 5 to 9, and then teenagers having fewer deaths each year. Overall, fires cause over 3,000 deaths per year, over 15,000 injuries, and $16 billion in property damage. And I think that home fires is an interesting injury challenge because these injuries and deaths are highly preventable. And so I'm going to focus the rest of my presentation really talking about how we can prevent this burden on public health. So home fires in particular, they make up for about 27% of reported fires, but they're responsible for a really large portion there of civilian fire deaths and fire injuries. And when we say here civilian, I'm referring to kind of general population and not firefighter deaths or injuries. Cooking is the leading cause of fire overall. However, smoking is the leading cause of fatal fires. And we see this in large part because of people who may be smoking and drinking and then fall asleep in bed. Here's another look at the sources of fire by death and injury, broken down by age group. So on the left-hand side, you'll see fire-related deaths among children. Most of the deaths are caused by heating equipment, a lesser number from electrical or cooking fires. On the right-hand side are the injuries. Many more injuries each year, mostly caused by cooking fires. In this category, we see that our teenagers are really at greater risk, and this is because at this age they may start participating in activities such as cooking. So there's good research to show that having a working smoke alarm will reduce the risk of death in a fire by 50%. The range of smoke alarms in homes has been documented anywhere from 39% to 78%, depending on the population being studied. The NFPA recommends a smoke alarm inside each bedroom, as well as on every level of the sleeping area, on every level of the home. And again, kind of estimates on how many homes meet this criteria have ranged. One study out of rural Iowa found that just 22% of homes met this standard. We had a study in Baltimore that found that just 40% of homes had a smoke alarm on every level. So not quite the NFPA standard, but still, clearly a lot of room for improvement to have our households protected by working smoke alarms. And so a lot of our research focuses on, well, how do we do that? What's the best way to go about helping families have smoke alarms in their homes? So there's been a robust evidence base around both the benefits of smoke alarms, the needs for smoke alarms, and then several program evaluations about how we might be able to get smoke alarms into the homes of families. These programs have included just general education campaigns, doing in-home inspections, as well as some kind of manual installations where people will go door to door and install the smoke alarms. And so part of our work is, how do we take this research and translate it into action? And usually when we start working with a fire department or another service provider who is interested in adding smoke alarms to their portfolio, we'll start with a couple questions for them to think about. So what is the target population? Is this a particular age group, children, older adults, perhaps an area of their service region? How are smoke alarm program going to be implemented? How will it be promoted? And really what we like to see our partners do is make sure that they're measuring the impact so that they can see change in their communities. So the next phase of this presentation, I'm going to talk about 3 different projects that we did with fire departments around the country. The first one is called the Johns Hopkins Home Safety Project, and this was in partnership with the Baltimore City Fire Department. For this project, we went door to door in East Baltimore to over 8,000 homes. It was established as a trial to test half of the homes in the service area received an advanced visit from a community health worker. And so you see that picture on the left, one of our community health workers just going to each door to notify the residents about this program and about the fact that the fire department would be coming a few days later to review and install smoke alarms in the homes. So one half of the households received this pre-promotion ahead of the fire department visit. And then on the day of the fire department visit, the fire department went door to door to these same homes and offered to residents to test their smoke alarms and install any new ones where they might be needed. What we found through this study was that the homes that received advance notice were more likely to allow the firefighters into the home, and they allowed more smoke alarms to be installed. And we think that the reason for this is that the advance notice gave residents the time to perhaps clean up their house a little bit and prepare for somebody to be coming into their home. I certainly know that if someone knocks on my door and I'm not expecting them, my house might be a little messier than I would like them to see. So despite the advance notice, however, we still found that 40% of residents were not home at the time of the fire department home visit. And so we know that while people were more willing to let the firefighters into their homes, they were not necessarily sticking around on the day of specifically to greet the firefighters to their homes. And so, part of this was then, well, how do we find those, how can we meet those other households where they're at? And so our next project that I'll talk about attempts that through a different type of partnership. And so this was a project in partnership with the Phoenix Fire Department, as well as the Nurse Family Partnerships in Maricopa County. And so for those who are unfamiliar with these programs, the Nurse Family Partnership is a program of home visiting nurses, and they go to visit new moms who are at high risk for health complications. And they visit the families for, from the second trimester through 2 years postpartum to help the mom and coach her through that risky period. And so these nurses have developed a really good relationship with their clients and ongoing, home visits. And they agreed to help us introduce the fire department to their clients. So when the nurses went out to their clients, they would talk to them about the opportunity for the fire department to come into their homes and install a smoke alarm. And for those clients that agreed, they would then schedule a follow-up visit from the fire department home visitors. The fire department would come out, install a smoke alarm, show them how it was used, and provide any fire safety education. We found that this was a really successful partnership in that over half of the homes that participated had no working smoke alarm in their home, not a single one. And so this was a really high-risk population that, our nurses were able to help connect to the fire department service and smoke alarms. So at the end of the study, every home had at least one working smoke alarm. And when we interviewed both the firefighters and the nurses about this project, we heard some really positive feedback. The nurses really liked having the skill and knowledge of the firefighters who were able to come in and provide this education to their clients. And the firefighters were really pleased to kind of have their foot in the door, so to speak, of this population, which can be, sometimes considered hard to reach. And so it was a really beneficial project for both organizations. And, they continued working together long after the funding for the research portion of this project ended. So the last project I'll talk about is working with some individual fire departments in 4 different cities to do a little bit of blanket promotion around smoke alarm programs. And so based on kind of the evidence that we had, we wanted to help fire departments implement some of these best practices that I've talked about. Going back to Baltimore, in addition to their door-to-door visits, Baltimore has a non-emergency phone number, 311, that residents can call and request a smoke alarm. And the fire department will come out within 2 hours of receiving that call and install smoke alarms. The service had not really been used a whole lot in the city. And so we worked with the fire department there to advertise the program through Facebook ads. The ads went out to 130,000 different users, resulting in 465,000 impressions. So 130,000 people saw the advertisement, a total of 460,000 times. That resulted in 4,367 individuals who clicked on that advertisement to find out more about the program. And that reflects a 1.3% click-through rate. And then kind of 25 of those people went on to actually complete a smoke alarm installation. And so while we didn't get a large volume of smoke alarm installations from this particular campaign method, we were able to spread the message that this service existed. Baltimore also did an automated call system where they did a phone call, a message that was recorded by the chief and sent it out to 90,000 different landline phone numbers. This was quite successful. It yielded 458 installations. And we were quite surprised to see kind of the old school technology yield actually better returns in terms of smoke alarm installations. So we took this information and worked with the Rochester Fire Department to do something very similar. In Rochester, they sent out an automated message recorded by their chief to 59,000 phone numbers. Those phone numbers were spread out over about 1 month. Rochester was a little bit concerned about overwhelming their units and didn't want to do it kind of all in the span of 1 week like we had done in Baltimore. And when we looked at the data for Rochester, we saw kind of a month-over-month increase of 7.5 times more requests for smoke alarms in Rochester. The next city we worked with was in Grand Rapids, Michigan. And kind of hearing from the success in Baltimore and in Rochester, Grand Rapids decided to do something similar. And they worked with their 311 call center to try and implement an automated message. In Grand Rapids, however, the story is a little different. They had some difficulty identifying phone numbers that they could send out calls to, versus Baltimore and Rochester already had lists of their landline phone numbers in the city. And so Grand Rapids was only able to send out 5,000 phone calls. And that was spread over 14 days. Sorry, that was called over 14 days, spread over 8 weeks. So because of this, they did not get a whole lot of requests for smoke alarm installations. And this was, when we kind of dug into this a little bit more, we learned that in Grand Rapids, the phone system there is on an old analog system. And so they were really limited to circling that message based on the number of phone lines the city had available to them. Whereas most modern phone systems are run on a digital platform and are able to handle a much larger volume of calls. The last city we worked with was in Cloquet, Minnesota. Cloquet is a rural community, and so they took a slightly different approach. They worked with their emergency service notification center. This is like the same platform that sends out alerts about like a tornado in the area. And so they sent out a message to 2,000 phone numbers that were registered with their system, spread over 5 months. They also had a new jurisdiction come on board to their area, and so they sent out postcards to each of the households in that new jurisdiction. What was really nice about the system in Cloquet is that because Cloquet is a rural area that's spread out over a much greater space of square mileage, they were able to send out these phone calls on a rolling basis to specific areas of their catchment area. And that means that when people were calling in to request an appointment, they could consolidate the appointments into 1 or 2 weekends, and it really reduced driving time all over their service area, and resulted in them being able to offer additional appointments that they hadn't done beforehand. And so they were quite pleased with that method of announcing their program. And so just to wrap up here, we found that promoting scheduled home visits can be really successful, but that fire departments really need to consider what their programs, what kind of infrastructure their programs have access to, and think carefully through kind of the need and the opportunities. We also really encourage fire departments to consider working with other partners, for example, the Nurse Family Partnership, who might already be in the homes of those in need of smoke alarms. And I think that we would love to see other home visiting programs, consider their fire departments as partners I know just from a lot of conversations that fire departments are eager to offer these services and happy to work with local partners who might already have relationships with their residents. So that, I will turn it back over to Dina, and thank you very much.
Thank you, Elise. Just a reminder to everyone, if you have a question, please enter your question in the Q&A pod, which is located at the bottom left of your screen. We'll be taking all questions at the end of the presentation. And with that, I'm happy to turn it over now to Monica and Sam.
Hey y'all, good afternoon or good morning, depending on where you're joining from today. I'm really excited and grateful to be here today to share a bit with you about our Red Cross Home Fire campaign and our methodologies. I'm Monica Owens-Doyle, and I'm the Community Preparedness and Resilience Services Manager at Red Cross National Headquarters. And before coming to work at the national level, I worked in our field network in Mississippi and Louisiana, where I was tackling community resilience building after Hurricane Katrina. And while I was working there, I also volunteered on the nights and weekends to go out with what we call our disaster action team. And I would go out and respond to single and multifamily home fires. And for me, I'll never forget the first fatal fire that I responded to. That is like burned into my mind forever. And so what I'm really grateful for is that through this program and together with our partners, we're able to help prevent that needless loss of life. And with generous support from a FEMA Fire Prevention and Safety Grant, the American Red Cross launched our Home Fire campaign back in October of 2014. So we're currently in our 7th year. And our goal is to prevent and alleviate human suffering due to home fire. And more specifically, we really seek to save lives and reduce injuries. And we achieve this goal by executing in-home fire prevention and safety visits, during which we provide education and we install smoke alarms. We also provide accessible fire safety equipment for people with disabilities. Our program is active in all U.S. states and territories, and we partner with tribal nations and other partners to serve tribal communities. And recently, our teams began collaborating with Elise Omaki and her colleagues over at the Johns Hopkins Center for American Indian Health to help adapt our typical in-home visit methodologies to better serve and connect with Indigenous people. So a little bit about our progress to date. These are campaign metrics as of August 31st of this year. So we have documented more than 1,000 lives saved to this program. And for those lives saved, what happens is we do the intervention in somebody's home, then they later experience a fire, and we understand based on working with the fire department and with our own response services, the nature and severity of the fire, and then we're able to talk to the clients, get an interview with them, understand what helped them escape the fire, and then we're able to kind of document that full circle from the prevention side all the way to the outcome. In addition to this, we've served people in all 50 states, 5 U.S. occupied territories, Washington, D.C. We've worked in over 18,000 cities and towns, and we've made almost 950,000 households safer. We've served nearly 2.5 million people. We've installed, at this point in time, more than 2.2 million smoke alarms, including more than 14,000 bed shaker alarms for people who are deaf or hard of hearing. We've also helped create more than 800,000 fire escape plans. So just a little bit of a revisit of the fire problem. And before I get started here, I just want to share that these statistics are actually from United States Fire Administration, so they're a little bit different, and we have a big data gap in the fire world, and that attributes some challenges on the prevention side to getting in and doing the work where it's needed to be done due to a lack of reporting by some entities. So Elise did a great job kind of covering the overall fire problem and the epidemiology of it. I just want to take a moment to just revisit the issue here. On average, each year, over 370,000 home fires occur, causing over 2,700 deaths, over 12,000 injuries. Furthermore, $1 billion is spent treating home fire injuries, and over $7 billion is spent in property damage due to home fires. So to help affect change around this issue, we really seek to intentionally serve communities that are at high risk. We work closely with our fire department partners. We work with other nonprofits. We work with community-based organizations, home health care businesses, faith-based organizations, and any entity that's going to help us access and serve these high-risk households. So we know that the absence of working smoke alarms is a key factor in home fire fatalities. Looking at the graphs here, 60% of home fire fatalities occur in households with no or with non-operating smoke alarms. So those places where people have removed the batteries or people have disabled their alarms or taken them down because of things like nuisance alarms where it goes off and you don't really have a fire, you were really just cooking something on your stove and the smoke triggered it. So in fact, having just one smoke alarm can cut the risk of dying in a fire by half. So this is a critical component to the prevention work that we do, ensuring that people have working smoke alarms. And to have that desired societal outcome that we hope to achieve, we have to identify and serve the 23% of households that have no smoke alarms or that have non-operating smoke alarms. So additional risk factors also have an effect in the likelihood of an individual experiencing an adverse outcome in the event of a home fire. We really try to get into the households where these risks converge. And so the more risk factors present in an individual household, the greater the potential impact of the programmatic intervention. So I just want to kind of show you a little bit more about these risk factors here. Poverty is the key cross-cutting indicator. Where people are living in poverty, they're experiencing fires at a greater rate. They're also not as readily able to bounce back after a fire or any other type of disaster. Rurality is a key factor. I've lived in several rural communities where I'd have to go over a couple mountain passes before I could get to the fire department. If my home caught on fire in that community, then it was very likely that it was going to be a total loss or it was going to spread to a greater percentage of my house. The housing type is also influential. So depending on where you live, if you live in an apartment complex, what your neighbors are doing is going to directly affect your outcomes in your household, right? If their home catches on fire, that could very readily spread to yours. Heating sources, things like space heaters, especially in places like the Deep South that, or places where maybe they don't have central AC and heat, and they're using things like wood-burning stoves. So that's a key factor in fire. Your age, as you increase in age, as you get older, you exponentially increase in your risk of death in a fire. And also those very young ages that Elise pointed out earlier are also critically at risk. Race and ethnicity plays a role here. We see American Indian populations just very highly affected, as well as the Black or African American community. Disability status, if you can't hear the smoke alarm sounding in the middle of the night, that's when most of these fatal fires occur, then you can't take action immediately and you can't escape. And so understanding what people may need in terms of adaptive fire safety equipment is also really critical, and ensuring that people who are folks that wear hearing aids during the day, who might be able to hear during the day, but they take those out at night when they're sleeping, that they also have that ability to receive that message. So our home fire risk map that I'm going to show you a little bit about here takes data that's available from the National Fire Incident Reporting System. This is where all of the fire departments across the country report in their incident response data. And the rate at which they report this data varies among departments and among states. So we have really great areas of reporting, and then we have other areas that are struggling to report for, a number of reasons. We also use data from the American Community Survey. We also use data from American Red Cross home fire safety visits and the Social Vulnerability Index to calculate risk through data modeling. So with our data modeling, we have partnered with DataKind DC to create machine learning models that help us identify and prioritize high-risk areas. DataKind DC is a chapter of a global nonprofit that leverages the skills of data scientists to help advance the mission work of nonprofit and other community organizations. And these models help us really predict areas that have the greatest risk in fire propensity, fire severity, and smoke alarm presence. And with smoke alarm presence, this is the risk that the individual household does not have a smoke alarm that's working present in the home. We use this data to create these models that then run calculations, and the census data tracker then assigns a home fire risk score between 0 and 100 based on the average of these three data models. And to account for differences in population density, these models use population adjusted figures. So for example, we're looking at fires per 1,000 residents or severe fires per 1,000 residents. We also use these models to fill in data gaps. So by scoring these areas and looking at the demographics of them, we're able to kind of assign a comparable risk score to areas that have not done as much reporting of their fires and prevention work, for that matter, in their communities. So this is a picture of are the national view, the high-level view of our home fire risk map. The Red Cross and our partners have been using this tool since 2016 to pinpoint high-risk areas. By using this tool, our teams can identify and visit those high-risk areas where few households have working smoke alarms. And in this tool, the darker the shading of red, as you zoom in, it also kind of changes based on, you know, the view you're looking at. You'll see that in just a minute. The darker the color red, though, the more likely this area is going to experience severe outcomes in the event of fires. And so that's where we try to intervene. So step one in this process is just simply navigating to our home fire risk map. You can simply Google it. It's going to be the top returned results. And the map is open source and free for anyone to use. And we're also happy to do additional trainings and support folks that are using it. So then you navigate to the desired area. And so you can either do this by scrolling with the tool, pressing in and out with those zoom buttons on the right-hand side, or in that search bar in the top, you can actually type something in. And the black borders that you see here are regional Red Cross geographies. And so we also have filtering capabilities, and these filters allow us to display census-tracked areas that are most at risk. So you can easily click through these filters. You can see the top 100 tracts in your area, you can see the top 25, you can see the top 10, et cetera. And these filters are currently based on Red Cross regional geographies, but during the future release, we intend to provide a county and state-based filtering capabilities as well. So know that that is coming in the next iteration that should be released pretty soon here. And that'll have even better data fidelity for non-Red Cross users. So step 4 is you're able to go in and explore the data. And when you move your mouse around and hover over an area, the data about that census data tract will appear on the left side of the screen. And the data feature includes the overall risk score, the census tract rank compared to other tracts in that same region, and the number of households in that tract, the median income, and the name of the tract. And if you're like me, you're going to like diving into the data a little bit deeper to really understand more about the community that you're planning to serve. This data can be helpful when planning events. It helps you understand what languages may be spoken in that community. Granted, it does have some limitations. It's not like a complete, thorough set of data, but it's useful information. It can be helpful to show you some elements of community composition, providing you with the 3 different risk scores to show you the calculation basis for those 3 models. And you can also access this data by clicking that View Data button at the very top of the screen. And in addition, you can export this. And so you can play with the data yourself. You can manipulate it in whatever format you would like to. And so we love working together with partners to tackle the home fire problem. It is an all-of-us problem in this country. It's not something that any one agency or entity can tackle alone. We have to do it together. You're more than welcome to contact your local Red Cross region to learn more about opportunities available in your area. We have training resources, client-facing materials, smoke alarms, additional resources that we can provide to partners free of charge and really go out and support them. And so we're really excited about any opportunity we have to work with others to better access critically underserved communities. It's really hard to get in the doors, and working through partnerships really enables that success. And what you see here is a fire department that we're partnering with. My volunteer partner, Marty, is all the way over in the left with the Red Cross vest on. And so this is up in Metro New York North, and this is obviously activity that was carried out during the pandemic. So we're still working, we're still getting into homes, and we're really excited to be doing this work. So just a quick snapshot of some of the updates that are coming. We're working on these updates to create a new version of the tool in partnership with our team of volunteers over at DataKind DC. The new version is going to include new models featuring the addition of dollar loss to the severity models. So it's going to go beyond just looking at injuries or fatalities as the indicators of fire severity, but also into kind of that rate of spread among the home and the loss that family experiences. Enhanced features for non-Red Cross users, including boundaries and filters that align with the typical U.S. geographies like counties and states. Increased model precision in smaller focal areas. And with this new model, we're going to go down to the census block group, which is the level down from the tract. So users are going to be able to further pinpoint areas of greatest need and target those communities to serve. And for a little more context, this change is going to represent going from 73,000 scored areas to more than 217,000 scored areas. So we're really excited about that. So we're going to have a greater amount of data to work with. We're going to be able to really hone in on the areas that need our help the most. This new release should be coming out in the next month or so, and it's also going to include the ability to update the data models and recalculate them as we get new information for certain neighborhoods. Like, so as you go out and do prevention work, you install smoke alarms, your risk of no smoke alarm in that neighborhood is obviously going to change. So we're really excited about that, and I want to thank everybody for having me here today. And now I'd like to hand it over to my colleague Sam Johnson to share a bit more about our youth preparedness programs. Over to you, Sam.
Awesome. Thanks, Monica. Great job. Hi, everyone. As Monica mentioned, my name is Sam Johnson. She is my friend and colleague. And so as we're thinking about the Red Cross program, specifically surrounding home fire preparedness, we try to take a holistic look. And part of that is offering free youth preparedness programs to our communities. So I'm going to be talking about our two signature programs, which is Prepare with Pedro, which is our kindergarten through second grade program, which is usually ages 4 to about 8, and then the Pillowcase Project, which is our program for grades 3 through 5, which is usually about 7 to 11 years old. So the Pillowcase Project is our first and signature youth preparedness program, which is, as I said, it's for 3rd through 5th grade students that we offer freely to our communities across the country and to U.S. military bases abroad. So this idea stems from, it came from the Southeast Louisiana Red Cross chapter after Hurricane Katrina, where essentially they saw college students from Loyola taking all their supplies to a Red Cross shelter in their pillowcases, because those were the only things they had to carry their items to the Red Cross shelter. From this, the Pillowcase Project was born, and it started as an art therapy program for kids recovering after the hurricane and is now turned into our general preparedness program. It's 40 to 60 minutes. Kids learn about a local hazard. They learn general emergency preparedness, and part of that general emergency preparedness is home fire safety, and we also always teach kids coping skills. At the end of the presentation, students receive a pillowcase to decorate with all of the items that they should put in their emergency kit or their go kit, along with our workbook and a fabric marker. Since the program began in 2015, we've reached over 1.6 million students. Growing from the Pillowcase Project, our regions asked us to build a complementary program for the younger audience. They would go into schools and offer this 3rd through 5th grade program. And we're like, hey, do you have anything else for our younger kids? And so this is how Prepare with Pedro was born. So Prepare with Pedro follows everybody's favorite penguin, Pedro, who loves to learn how to be prepared and take action during emergencies so he can learn how to help stay safe. This program is a little bit different from the Pillowcase Project, whereas the Pillowcase Project, we learn about a local hazard, a coping skill, and general preparedness. Prepare with Pedro, because the audience is younger, we only focus on one topic. So when our presenters go into schools or to classrooms, they're just teaching about home fires or they're just teaching about hurricanes, but we always teach that coping skill as well. So this program follows Pedro as he learns about that local hazard. It's a storybook format. It usually takes 30 to 45 minutes with practice activities and practicing that coping skill as well. Every student gets to take home that storybook in the hopes of sharing all of that information, both with the Pillowcase Project and Prepare with Pedro, with the grown-ups in their households. So as I mentioned, the Pillowcase Project started in 2015, and Pedro started in 2017. It's now nationally implemented, and we've reached over 75,000 students, and that number is growing every day. As I mentioned, traditionally we are in school classrooms or after-school programs like the Boys and Girls Clubs, Boy Scouts and Girl Scouts, churches, other youth-facing community organizations. That really shifted during COVID, part in the sense that we can no longer go into classrooms anymore. And so we have now modified our programs to be done virtually. So you can see at the top screen there, kids are learning from the Pillowcase Project via a computer screen. All of our programs are done live. And over the summer, when the weather was still nice, we were able to do social distance presentations outside for outdoor camps with masks, of course, as well. So even though it's not the most ideal situation, we're still being able to provide our life-saving education to our communities. Beyond that, we have several other youth-facing resilience resources that are all complementary to these programs. A lot of times we go into schools or working with these other organizations and they want more than just the hour or the 30 minutes that we can provide them. So I think you all will have access to these resources via redcross.org/youth-resilience, but we have resources to you as an adult or as a caregiver, helping your child cope after disaster, additional coping skill resources for students like our Preparedness page or Resilience and Coping Skills activity book, and a few other great resources that you can see right there. Last but not least, of course, how you can get in contact with us. Those are our email addresses, and you can follow us along on Instagram as well. We're always posting the most relevant and new youth-focused resources that we have available to you all. So give us a follow, and please reach out if you have any questions. Monica and I are always happy to connect you to your local Red Cross chapter, so you can schedule a presentation for any youth in your life, or just learn more about our programs. And that is all I have for you all. Thanks so much.
Thank you, Sam. So now we will go ahead and take questions from the audience. So a reminder, please type your question into the question and answer pod that is at the bottom left-hand part of your screen. And while we give folks a chance to pop in their questions, question for all of you. Do all states have laws that require smoke alarms in the home? And I'm going to couple it. I know we talked a lot about smoke alarms. Do you also recommend that families have fire extinguishers in their home?
Yeah, I can perhaps go first to answer that question. To my knowledge, yes, states do have policies to have smoke alarms in homes. It varies in terms of its implementation, if it's done at the state level or a city and jurisdiction area, as well as to how that policy is actually implemented.
I know in terms of fire extinguishers, it's something that while we don't specifically provide it with our program, it's something that many communities do encourage residents to have, and it's something that's good to have in your home for sure, because then you can just be that much more prepared. The key thing with fire extinguishers, though, is to know when to stop, right? Like, know when to, get out of there and make sure your egress isn't blocked, and to be able to escape properly and not get trapped. So yeah, I think it's a great fire prevention and safety tool to have in your home. It can also help those people that might have a small manageable fire to keep it from spreading and becoming a large catastrophic fire, especially if you were like me and lived like 40 minutes from your nearest fire station.
Great, that is definitely helpful. So we are starting to see a lot of people not have a landline. I know I don't. How do children know when and how to call 911 if they don't have a phone of their own and there isn't one in the house?
Yeah, that's a great question. To my knowledge, most 911 operators and operator groups are going to recommend, first of all, that regardless of whether or not there's a landline, children should learn from an early age their address, a parent's phone number, and when it's appropriate to call 911, the number to call if there's an emergency. And so I think that's just part of the conversation to have with young children as they're learning to navigate the world. I've heard, again, from kind of the dispatch groups that they say the best protection is to have a landline phone. And again, if households are choosing not to, that again, kind of having their children know their address and their parents' phone number so that if they do need to make that phone call, they'll have the information ready to give the operator in the event of emergency.
Great. So this question is specifically for Elise. So in Baltimore, did the community worker go into the home with the firefighters, or did they go at it alone?
No, so the community health worker went a couple days before the fire department arrived, as well as about maybe 2 hours or so before the fire department. But they were not in the home at the time of the fire department home visit.
Okay, great. And speaking of firefighters and the fire department, so question, was the funding for the smoke alarms at all covered by any of the fire departments?
Sometimes. So, some of our projects, the smoke alarms are covered by the actual research grants. FEMA funds a lot of smoke alarm programs, and so the funding for smoke alarms might be trickled down through a fire department. A lot of fire departments have their own budget line for smoke alarms as well. And so, again, depending on the department we work with, we'll either kind of supplement their funding for smoke alarms, given that, we're asking them to take on an additional installation burden. But other fire departments say, you know what, we have a stock and we'll use what we have because we have a budget line for it.
Great. A question for all three of you. So what tips can you give to organizations that are trying to get the word out to a very specific community? Like how, who to contact, a partner, to do either a region-wide phone message? What is the best way to approach some of the red tape that I'm sure is out there?
So for us at the Red Cross, a lot of what we do is more grassroots community mobilization type work. And so we try to understand what community we're trying to intentionally serve, right? So then we go and we dig a little deeper, figure out who are the key influencers in that community, or where are those community members accessing information. We try to integrate it with where they're already going. So I used to work in Gaston Point, Mississippi, which is this tiny neighborhood in Gulfport. And it's largely African-American longshoremen, very impoverished community. I went to the 3 African-American ministers in that neighborhood, and we put information into like the church bulletin. We got the ministers to announce it from the pulpit during Sunday service. That's how we got the word out in that community. So I think you really need to understand like what's the scope of your project, and is it a big statewide push or is it a small neighborhood push? And I think that's going to direct what kind of course of action you want to take.
Great. Are there any other examples of using text messages to do outreach?
So
we've done,
I don't know of any.
Ahead.
Oh, yeah, I don't know of any specifics around text messages. When we tried the automated phone messages, the systems that we had really were limited to having access to landline phone numbers. Again, kind of related to that same question around having cell phones and landlines to call 911. There's just a lot more unknowns around cell phones, and so it's much harder to kind of do some of that automated messaging.
I was going to share that we have done text message campaigns at the Red Cross. It's typically been with previous disaster survivors that we're trying to outreach and offer the smoke alarm installation service to. So we already had their cell phone number. We try to do this very much in moderation, because as soon as somebody replies like stop to quit, like according to the FCC regulations, you can no longer ever message that person again in that manner. So we use it in moderation. We haven't found that a ton of people were really taking us up on it, so I don't know if it's the most effective way to reach out to folks, but it is a method that can be used if you have the data.
Great. And then speaking of data, does anyone have information or data about any local prevention coalitions, local fire departments that are providing tenants or homeowners in vulnerable communities any audits of their homes, which include financial, other support, to replacing, identifying defective smoke alarms, kitchen appliances, heating appliances, hot water heaters, other risks in the home?
think it varies greatly depending on where you live and what resources are available to you. I do know that we had some areas in Mississippi where they worked on what were called weatherization grants, but they did a lot of that very similar work. And when we were there, they would go out and do home inspections, and they would help do upgrades to people's appliances. They were also trying to prevent, home fires by ensuring people had proper heating and safety equipment. We used to see things like daisy-chained electrical cords where we had refrigerators plugged into power strips, which is really dangerous. And so we did a lot with the weatherization programs, but I think it just differs depending on what resources and assets are available at your local community. But I don't know of any like broad national coalitions like taking action in that space.
Yeah, I agree with that. A lot of fire departments do offer the services. I think if it's something that you're interested in exploring in your own community, typically, your fire department is a great place to start, either with the fire marshal's office, or sometimes fire departments will have a staff member dedicated to smoke alarms and fire prevention, who can kind of walk through what offerings they have at the moment.
Great, thank you. And then speaking of data and evaluation, has there been any evaluation of any of the school-based education programs?
Yeah, we have our internal evaluations after we've done a presentation on a national level. We used to be funded by Disney, and so we'd offer an evaluation of knowledge retention after the presentation was given. Because it is with youth, though, we have a really hard time collecting data post that presentation, obviously because the privacy put in place to protect kids specifically is very strict, rightfully so. So we have an understanding of kids' abilities to understand what we've taught them at the moment, but it's a little bit more challenging to do follow-up data, specifically in the COVID space. So it's always something we're working to get better on, but at the moment we do understand that most kids know the important information after we've given our presentations.
Well, that's wonderful and obviously very important work. Can we talk about a little bit about the devices for the hearing impaired? Are those available to community groups for home installation to make sure that we're reaching those vulnerable populations as well?
Yeah, so we partner with all kinds of organizations to reach those community members that may need that supportive device and accessible equipment. Your best bet is to reach out to your local Red Cross, or if you email me, I can help make that connection and facilitate an introduction, because we're always looking for partners to help support that work. We do offer in-home technical, installation of the devices to our workers or our fire department partners in many communities, but absolutely they're available. We have some on hand, so shouldn't be a problem to make that happen.
So something that we touched upon a little earlier is about being in a rural community environment. How do you recommend that families that live on farms prepare for fires, or we see a number of fires that are related to trailer homes that are improperly wired, also in rural communities? How do we help those families, and how do we reach those that are really vulnerable?
I can take a first crack at it. And so, for us, I think that the core tenets of fire prevention and safety still remain the same regardless of where you live. Having working smoke alarms is going to be your key protective action for your family. Having that fire escape plan, practicing at least twice a year, testing your smoke alarms monthly, ensuring that everyone knows how to get out, making sure that, you can open windows. I know I have family members that live in South Florida in old farms. Some of those are painted shut, right? Making sure that the device is open should you need to escape that way. And I think that in rural communities, it's the same as it would be like on the farm. The same kind of key components of fire prevention and safety remain the same. You may want to also look at things like introducing yourself to your neighbors. So if you need to stay somewhere for a little bit while you wait for fire services to get there, making sure you know your neighbors. And sometimes in rural communities, that can be a mile down the road, 2 miles, or further.
Thank you very much. And unfortunately, that is all the time that we have for today's questions. I really would like to thank Elise, Monica, and Sam. Thank you for joining us today and sharing about your very, very important work. This has been a very informative webinar. Thank you to everyone in the audience that has joined us today. We appreciate you taking the time, and we would appreciate you taking a little bit more time and completing the evaluation for today's session. We will launch the evaluation link for everyone in the room. So thank you so much for joining us.